power plants, and especially addressing the need to have better environmental regulations so that there is a enforcement check on how much emissions are coming from these coal-fired power plants. So this is something which has been a very weak issue in India, and that's something that we've been addressing, among other things. So on one side, we are looking at these anthropogenic sectors, industries, power plants, transportation sector, household energy consumption, things like that. But we also focus on some of these natural events, partly man-made natural events as well. For example, the slash and burn that happens during the harvest season. So that's a really big issue, especially in the northern India in the winter months, and during the summer months in the southern India. So that's something that we seriously keep track of. Similarly for dust storms, sea salt, and a few other sources. So we are now quite comfortable and extending the way we've been doing each of these sectors. And for this, I'll primarily focus on what we have done for the household energy consumption. And before I get into the methodologies itself, so this is the final result of what we want to show. So this is the percentage contribution model of household energy consumption to ambient PM 2.5. And this is basically a culmination of modeling all the emission sources that I mentioned earlier and putting that together. And this is isolating the household energy consumption. And there are 640 districts that are listed here. And we basically have delineated a lot of these numbers by different subsections as well. I'll go more into those details. And trying to look at each of these districts independently. For example, we talk a lot about Delhi. And if you go look at Delhi's household energy consumption, so what we have done is we've broken it down into cooking, space heating, water heating, and lighting. So you can immediately see that in a place like Delhi, gas and electricity is used significantly. So it basically drops down your cooking portions, but the space heating really jumps up. So that's what contributes a lot. Even in a place like Delhi, one would assume that it's a megapolis, and you probably won't see much of emissions from the residential sector, but so not from the cooking, but non-cooking activities really jump up. So if you move slightly to the neighboring districts, then the picture starts changing a little bit. Cooking fractions starts coming up. So this is a satellite city for Delhi called Gurgaon. So here again, cooking goes up significantly because you have a lot of low-income groups in this district, a lot of labor force, and that really creates a lot of these emissions. So I'm here showing 3 different pollutants, PM 2.5, CO2, and BC, mainly because they have very distinct features between themselves. And when it comes to black carbon, this is where we talk about core benefits linking air pollution and the climate change issues. And here, every time you see this orange pie, so this is basically kerosene combustion for lighting. And you won't see that much of emissions coming in the PM 2.5 spot because a lot of other emissions are also there. But in black carbon, we see a lot of that jumping up. And even a place as remote as this is the border district to Pakistan. So obviously, as remote you go, your gas to electric consumption really drops down, and your other fuels start jumping up. So I have a series of examples here from different districts. So this is one of very high density districts in Bihar. So when we say high density, we're talking about close to 2 million people just in that one district. And so you can immediately see the emissions, total emissions actually jump up, and the health impacts are also jumping up. So here, this is a very rural district, so you end up seeing a very high percentage of contribution coming from the household energy consumption. So you don't have that many industries, no power plants in the vicinity, and majority of the activities are from residential or transport passing by on the highway. So you basically, rural districts like these, you have a very high percentage coming from household energy consumption. Similarly, this is in the Northeast. So when you go into the Northeastern states, you basically don't have much of industry at all. So you end up seeing close to 50% of the pollution coming from household energy consumption. And this is I wanted to highlight this district, Korba. This is a district where close to 15,000 gigawatts of, sorry, 15,000 megawatts of power generation capacity is there. And most of the power is actually put onto the grid and went to the neighboring states. So even though the electricity generation is very high, you still have kerosene usage for lighting in the district. So this is something which needs to be addressed at a very central issue. This is Hyderabad, another capital city. And again, it's a big city. Still, you have only 70% of the gas to electric consumption. And this is one of those cities where it's significantly expanding, which means that a lot of migratory population is in the district. And that basically contributes to your non-gas and non-electricity consumption for emissions. And this is Goa. This is a very high income state, but still you end up seeing a lot of emissions, especially in the cooking sector and lighting industry. Just a couple more examples. This is the southernmost tip, and you have basically a mixed bag, a 50-50 clean and non-clean energy, and a lot of demand for kerosene. Even in the remote place like Andaman Nicobar Islands, you have very little gas and electricity being used there for cooking and other activities. So basically the idea is putting together a lot of databases on each of these 4 subcategories: cooking, lighting, space heating, and water heating, and put together this analysis basically. So I'll quickly go into how these databases were established and what kind of improvements that we made in putting this together. Second, I've mentioned that already. So what we think is whatever improvements we have done, it still is an underestimation because, for example, space heating, even during the daytime in the winter months, you have a lot of heating demand, and that's primarily met by burning wood or waste, or in some places even unconventional things like tires and stuff. And there are places where, for example, this is actually in Goa and a lot of other southern states as well. So you don't get, if not everybody uses basmati rice from the shops. So it's actually boiled rice that they use. So after the harvest season, the rice is actually boiled with husk, and the husk is removed, and that's what's sold as boiled rice, and it's very commonly used for a lot of households, especially in southern India. And that process is all done this way. So as soon as the harvest is finished, you can just drive across the roads, and you will see this happening all over the place. So smaller fields will have small spots like these, but you can also you will also find some industries where they're doing this on a mass scale. So this is a low-end rice that happens. So these are the things that we completely miss in the inventories when we just go with the fact that, okay, our state has so many people, so much energy demand for cooking, heating, and you start putting together analysis. So some of the things that we have done is linking up with the new census fields. So this is where the new big improvements have come about. So one, you have databases coming at the district level by age group, and we also have enough information from each of these districts on how much of the population in the district is actually labor force, and how much of the population is using different kinds of have access to different kinds of foods, and how much of what's the primary fuel for cooking and lighting in each of the households, with a urban-rural classification. So within a district, we know that not the entire district actually operates at the same scale. So we now have access to information to even delineate that part. So this is something it's a huge improvement compared to the 2001 census, and a lot of information is put together. So what we have done is basically using a lot of that in databases in putting this together. One more layer of information we added to these calculations is adding the meteorological field itself. So previously, a lot of calculations were done with the assumption that, okay, this is southern India, so you don't need that much heating, so especially in the summer months, so we don't need so we basically zero out those emissions. But I think that's a big mistake and leads to a lot of underestimation. So we basically link this database to a dynamic meteorological fields, so we can actually have a trigger in the calculations if and when the heating is going to take place. So the advantage of doing something like this is, by default, you will have emissions in the winter months anyway, but you also start tracking emissions that might happen in the summer months as well. So the colored spots that you see are actually hilly areas. So even in the winter months, the temperatures actually drop to, in centigrade is 15 degrees centigrade or even less. And we do see a lot of heating demand in those areas. So even in a month like September, that spot on the west side is all the Western Ghats, and most of those areas actually use different types of fuels for heating. And this is a space heating demand. So improvements like these helped put together an analysis where we tried to cover that underestimation that we've seen in the global models, which are basically done at the state level or at the national level and then distributing it to the grids. And another layer that went into the analysis is coming from the national sample surveys. So instead of putting a per capita energy demand for cooking and heating, so now the national sample surveys have information on what kind of food is consumed in different states, both in an urban setting and also in a rural setting. So if you have seen some of these pictures in the Time magazine a couple of years ago, they've actually gone around saying per week what kind of food is consumed in different households. This is actually an Indian family in Gujarat. This is Ulaanbaatar, Peru, Hungary, and Germany. So they've done this. So similar assessment has been done on the national sample surveys at the state level. So this really helped us also not just use a default energy demand function for cooking and heating, but actually customize it to the district's level and to the state level. That really improved some of our understanding on where the energy is going and how. And a lot of these emission factors, this is the work that's been done at IIT Mumbai. So we basically worked with them in putting the databases together. And just a quick summary of analysis. Once we have broken down these emissions to the district level and also adding the meteorological fields to the system, we can also we can tell what the shares are month by month. So we are not using a emissions database, constant emission database for all days of the year. So we can actually spread that across. So this is something for PM 2.5. You can see that the cooking fractions actually drop down in the winter months when the heating demand jumps up, and something similar for black carbon, where the lighting portion actually jumps up. So the lighting contribution, basically kerosene consumption, is contributing anywhere from 20 to 30% of the black carbon emissions. So this is something that's linked to not only pollution in the household sector, but also to the electricity demand in the country. So this is basically, at the end, would look something like this. So I don't have the comparison picture with the global emission databases, but a global emission database would have a lot more lighter colors in the southern India, assuming that there's not much of a heating demand. But we basically corrected that and be able to address the demand there. So this is more the chemical transport modeling part. Once we have all these emission databases, not just the residential sector, but also other sectors coming in. So we overlay them all together with the meteorological fields, and you have basically understanding of where the emissions are coming from, where are they going, what's the intensity of the pollution in each of these districts, and what kind of shares are we looking at. in comparison to all the other sectors. So this is the new addition into the analysis, looking at the health impact assessments, and this is basically following the methodology proposed by the global burden of disease. So earlier assessment in a couple of months ago, we were using the 2010 methodology, but now that the GBD 2013 assessments are out, so we were able to use those curves and basically separated the health impacts for the household energy consumption. So this is basically close to 20%. And it will be anywhere from 20 to 25% of the overall national global burden of disease of PM 2.5 pollution could be now linked to household energy consumption. I mean, if we compare this to other sectors, power plants is anywhere from 15 to 20%. So even though there are only 150 coal-fired power plants, they contribute anywhere from 15 to 20%. And the road transportation sector, focusing mostly in the urban centers, comes to about 20%. So they're all in the same ballpark. And so what we have done is for each of those 640 districts, so a lot of all the information has been summarized. So this is a bit wordy. We made this little wordy because we're actually sending these reports to each of the states, and we want to make sure that if they send forward it to the district officials, they actually have some background information on how we have done it. A lighter version, just the numbers and the results, is actually going to be on the web in a more interactive fashion. You can just go to the website and see all those results. So basically that's what we've done at the household level. We basically delineated all the information from both census, meteorological fields, and not only looking at them at the state and district level, but also at the grid level with a dynamic mapping. Did some dispersion modeling, disease burden of assessments, that's basically linking it to health impacts. And that's the last step, is district level dissemination. So that's basically an ongoing process. So hopefully by January or February, we are going to take this forward and be on the road for more spreading the results, basically. So that's the summary of what we have done for household energy consumption.
So now, thank you, Sarath. So now we're going to open it up for some questions. We have a couple of questions around the room here, and then please, those of you who are joining by phone, if you can just type out your questions, then Julie will field them as well.
Thank you for the presentation. I wanted to ask a question about if any life cycle impacts were considered, especially when you were looking at electricity consumption. Is it just focused on the point of use, from the point of use by the consumer, or were you looking at the biomass source for the power generation?
We didn't do any life cycle assessments, but we have looked at each of the sectors in parallel. So for example, the power plants, so when we did the analysis, we know where the power is generated and where it's going. So that really helps us understanding where the demand is and where it's not being met. So for example, a place like Bihar, where the population density is really, really high, but a lot of power generated in Bihar actually goes to the southern states or to the west, but it's just not met there. So that basically jumps up your usage of kerosene and other fuels for heating and lighting. So those kind of signatures are something that we are tracking at the district level. Yeah.
So while we're waiting for Christine, I know Christine on the phone has a question. I'm going to ask a question while we're waiting for hers to come in, which is that one is if you have an idea of maybe how this compares to some of the other more spatially inclined work that's going on in India at the moment, and also if you can perhaps comment on what is the potential application of this kind of of this methodology for other countries and regions as well?
So it's an example from our own work with the coal-fired power plants. So till about 15 years, they didn't touch the environmental regulations at all, which means that the emission standard for PM was really, really high, about 10 times higher than what's practiced in China. And what we have done is as similar to this, we basically analyzed all the emissions and pollution coming from the coal-fired power plants and distributed that report to all the ministries saying that this is the kind of impact that we're seeing because of lack of regulations. And within a period of 3 months, the report was actually floated in the Rajya Sabha, and there was during a Q&A session from the Minister of Health to Minister of Coal and Power, and asking why the regulations are not being touched. So they formed a steering committee. In April, they have now issued a new set of emission regulations which are at par with US, EU, China, and other places. And in fact, they're actually proposing emission standard for mercury, which doesn't even exist in US. So this is the kind of impact that we are expecting through studies like this. I mean, not just at a sectoral level, it really helps in separating it out and giving it to ministries, because ministries do operate a bit in silos. But at the same time, having all the sources of information in one place, and it really helps us in educating both public and the public bodies at the same time, saying this is the kind of pollution that we are seeing, and this is the kind of shares that we are seeing contributing to each of these areas, so we need to do something about it. So we find that a similar application can be replicated for many different countries where it's not actually in practice. The at least case of EU and US, this is something that's done, and it's been being done for last 10-15 years or even longer. And this is something very new, and we are hoping that once we get to a district level dissemination program, once the district level dissemination program goes online in January, we are hoping that the reception from the ministries will be much better, the way we have seen the reception for the power plant sector or the transport sector. Yeah.
And now we have 2 questions from Christine Wiedenmeyer. One is whether you know how much the boundary conditions and emissions from surrounding areas might actually, how much they could actually impact the PM concentrations as well as the health impact assessments. Mm-hmm. And she's also wondering whether you have estimates of organic carbon.
Yes. I won't go back, it takes a long way. Yes, the emission inventory includes organic carbon. So within PM we have, so when we say the PM 2.5 map, it actually includes both primary and secondary components. So the primary components are your primary PM fraction, BCOC, and then the secondary fractions are sulfates, nitrates, and some secondary organic aerosol, because we are running it through the dispersion model with full chemistry. That is there. The boundary conditions itself, at a regional scale for this model, the boundary conditions are coming from the Mozart model. So if there is any perturbation in the PM pollution outside of India, we do catch it in the boundary conditions. At the same time, within the district, at the district level, now the dispersion model that we're using is CAMEX. So the model actually allows us to even apportion the amount of pollution coming from the emissions within the district and from the neighboring districts. So we will be able to tell that fraction as well. So if a district shows up as a 60 micrograms per meter cube, then we can actually break it apart and say 40 of this is actually local emissions and 20 is from the neighboring districts. That's also a possibility.
And she says, great, thank you. Other questions from either the phone or from around the table here?
This is Liz. I have a question. Besides public officials, did you show these results to anyone in the communities, either the household owners or the people in the district, and were they surprised by any of the results?
No. So that's mainly because everybody knows pollution is an issue and it is bad. So what we are trying to do is actually put a number to that problem. And yes, when we are not only taking it to the public officials, we are actually creating forums, public forums, where the information gets disseminated over mobile phones, newspapers. The newspaper is still a very well-read and well-circulated media in India. So we are trying to tie up with the local newspapers in as many districts as possible so that they can actually place a note there. So okay, today's pollution is going to be this much or tomorrow's pollution is going to be this much. So we are taking it to the public. So at least in case of power plants, though it's a big sector and it's a very limited number of sources. And when we do an analysis like that and send it to the ministries, they'll immediately pick it up. But these sectors, for example, household sector, and you want to demand gas and electricity for every household, that is not something that's going to happen by a Q&A at the top. I mean, and this push has to come from bottom up, and we are basically trying to empower at the lowest scale possible so they can actually ask for the change. Yeah.
Other questions?
So did you find any challenges in communicating any of this information to the various audiences? Since you're communicating from policymakers to researchers to sort of the ground level, what has been your communication strategy in making sure that you can effectively communicate these type of results?
Yeah. The biggest challenge has been skepticism in modeling. Basically, not all ministries or not all bodies are openly accepting the fact that this is model number and this is great, I'll take it. So that doesn't happen. So for that reason, we have to tie up with programs where we're actually going and doing on-ground surveys, on-ground monitoring, because monitoring is also a very weak sector in India. I mean, if you look at the number of continuous monitoring stations operated in India, that's 40. And if you look at China, 2,500 plus. So it's a huge gap. And that is something, it's not going to go away if there is no bottom-up push. And that is our biggest challenge. And people can always say that, yeah, you cooked up these numbers. I mean, we are, in a way. So the challenge is that, for one, they have to prove us really wrong, and because a lot of ground truthing is going on in building up these databases, because we're actually going to the ground and taking measurements also at different industries, brick kilns, for example, and putting all these things. And then the next one was how we're going the communication part. Yeah. So one is basically going through the news outlets and in different areas, and they're also tying up with the NGOs because they are the ones who actually do some root cause information journalism and everything. So they're trying to push some of those things.
Your global burden of disease numbers have been, greatly improved over the past few years, and now that you can have these numbers at a district level, do you see that, will you be able to communicate with the health sector? Do you think that will have an impact based on your new numbers, and have you tried to communicate with the health sector at all?
So this work hasn't gone public yet. So hopefully in a couple of weeks or so, it will definitely go, it will be put up on the web and go public. But health is something which triggers the discussion. And we've seen that in the transport sector, we've seen that in the power plant sector. And when we're talking to folks in the cities, and that's the primary trigger that really gets some of the action going. And we were hoping that putting a share to household energy consumption will bring some focus to the sector, and which has been missing quite a bit.
And now we have a few questions coming in from the phone. Michael Johnson would like to know whether emission factors are based on the field or lab testing, and what might be the implications of using lab instead of field or vice versa?
It's a half and half. Some of the tests were done at IIT Bombay under Chandra Venkatraman's group, when there's some experiments which are done in the field using, for example, atherometers and PM monitors. So wherever possible, especially outside cooking patterns. So that's something that we have done, but very limited number of experiments were done in that respect. And yeah, there will be certain change in the sense we do anticipate some uncertainty in the assessments, but in the next couple of years, that's something we're trying to improve by having more programs from in 17 specific districts. And this is the program that will go on. It's an ongoing program from IIT Bombay.
And now there's a question from Ajay Pillai-Sethi, who would like to first compliment you for your great and exciting work. And he's wondering how you disaggregate the background disease data at the district level to get the health numbers.
Yeah, we didn't. So the global burden of disease assessments are, the data available is only at the national scale. So the attributable burden, we basically use the same numbers for all the districts. Okay. So hopefully if more information is available at the state or the district level, we have the flexibility to adapt that. Yeah.
So just population weighted, yeah, basically. And then Christine would like to know whether these emissions are available for other modeling studies.
Yes. Because Michael Brower, I think he's also online, so they're already using that. So there are other groups that it's open for sharing and using. Yeah.
Okay. Other comments, questions? Seema has another question, and I also want to ask, if you were to pick 3 other countries or regions to do this work in next, beyond India, where would you focus in on, just in terms of an interesting mix of sources?
And my last question was just a simple question of, is there an opportunity also to feed in additional information, or are you pretty much at a stopping point before you publicly release it?
We are open to, if we have any, we find something that can be corrected, we are pretty open to that. Yeah. When we are using when I said, for example, Mike Brower is already using it because of the kind of improvements that we have done in the inventory, in the spatial allocations compared to what was previously being used, basically the Edgar emission fields. But when we are constantly improving it, so one of the points that what Michael Johnson has asked, emission factors. So as and when we get new tests done and we see a change in the emission factors with different fuels, we'll definitely be changing that. But that's something that we're not expecting to happen next week or in a month or so. But right now, so this is what we feel is the best available information under those 4 subcategories based on the new surveys and data coming in both from census and the fields. And to your question, something in the Southeast Asia would be really ideal. And even within South Asia, you have Nepal and Bangladesh, which are very much in the same boat in terms of the energy use pattern, probably even worse, probably on a per capita basis. So those will be really a good place to target as well, even 1 or 2 in Africa.
Okay, and we have another question coming in from the phone. Just a second as he finishes typing. He says, do you have information on indoor air pollution, or is this only household contribution to total air pollution?
Okay. So what you're seeing here is the contribution of the energy consumption to ambient air pollution. But we can change that and calculate what's the burden in the indoor air pollution. Also this is something that when we've really been thinking out loud here. So one of the census fields now actually tells you what kind of houses, both in terms of size and when ventilation material used, that kind of information is available. So if we link that to the fact that, okay, these many number of households in district are living in these kind of dwellings and they're cooking inside. how does that translate into indoor air pollution? So that is something that can be done, but at least in this setting, we haven't touched it, but it's definitely possible.
And I think since we have Michael Johnson on the phone as well, it would be actually quite interesting to see with the different types of housing characteristics, how you could look at the breakdown with different types of box modeling maybe to get kind of different assumptions about the indoor air concentrations and then the household, to ambient differences. So I could.
So again, this is one of the fields which is new to the new census. So this was not available in 2001, but in 2011 they actually had a house on average within a district, how many 6-room houses are there, 4-room, 5-room sizes, even roofing. So that will actually give you an idea of how much ventilation is there in spaces and things. So we can actually put a back of the envelope calculation for that.
Any other questions, thoughts, comments? Any final remarks from Sarath? He's already thinking ahead for what next, I can see.
Yeah.
Okay, so with that, I think maybe we can all thank you for a very interesting and thought-provoking presentation. Lots of good data to be shared and other ideas for potentially maybe even some collaborations with some folks on the phone, I can imagine. So thank you very much.
Yeah, thanks. Ciao.
And there are cookies here for those of you that came.
Yeah.
And thanks again to those who joined via phone. Like I said before, we did record this, and we'll go ahead and make the recording available on our website. And with that, I think we'll go ahead and hang up the call. Thank you.